This video is about thread lifting, your top 5 questions answered. My name is Dr. Lisa Vuich. I'm the owner of Renew Medispa and the Renew Medispa Training Institute. I am a master trainer. I do train on thread lifting procedures, which means I teach doctors and nurses how to perform these procedures. As you may know, Renew Medispa is located in Derry, New Hampshire. And I see those top 5 questions as, is it new, which is sort of a variation on, is it safe? Because we're always a little wary about new things, thinking, what's to expect? Is it really something I want to do? Question number 2 is, what does it do? Number 3, will it hurt? Number 4, how long will it really last? And number 5, when should I do it? Or in other words, where does this really fit in? So thread lifting, to start off with, is really not new. The use of lifting threads in modern facial aesthetics began back in the late 1990s for sure. These were permanent sutures and did have some complications, so they pretty much fell out of favor. When thread lifting really took off, especially in the US, was when threads made of PDO became available. That stands for polydioxanone. So what's new really about thread lifting is the advances and improvements in thread design, even over 5 years ago, new patterns, etc. So that the field is still evolving, but the most common material used is PDO, and there's nothing new about PDO. Question number 2, is it safe? I already started to get into that a little bit. The materials that are used in the threads are very biocompatible. This means they're designed to dissolve over time. They're designed to work with the tissues in your body, not to cause a problem, not to cause scar tissue. Threads are introduced through small needle pokes, and these needle pokes are essentially the size of like an IV that they might start in the emergency room. So they're not terribly big. There are hundreds of thousands of thread procedures performed every year. Complications or side effects really not that much different than what we see with other procedures we do at the medical spa. For example, temporary swelling and bruising, post-procedure soreness. Side effects unique to threads are things like dimpling or surface irregularities, which are very temporary. And if they persist, we have methods where we can smooth them out. Well, to understand what they do, you have to understand a little bit about facial aging. If you look at that image to the left, if you look at the white lines there, those are facial ligaments, and they get saggy and they start to drop as we get older. And that's one of the ways that threads help us, is actually by grabbing onto those ligaments and lifting them up to a more elevated position. So where threads really help us is with collagen and elastin loss, because they stimulate collagen, and also with that facial ligament loosening, because the threads enable us to reposition the soft tissues and to give some support back, some structure underneath. As you can see here, we can achieve quite a bit with threads, especially with the lifting threads. Will it hurt? Good question. We do have to inject some lidocaine. By the time the threads are being placed, you're just going to feel a sense of pressure. You're not going to feel anything sharp. So pain is not a huge part of this. It's just getting past that numbing stage. As with most things in aesthetics, you have to be numb, and the numbing is a little uncomfortable, but then that makes you very comfortable for the procedure itself. Now, how long will threads last? You're going to see everything online, from they do nothing to I've done great for 2 years. And there are reasons why it's all over the map, but I wanted to show you this one little interesting study. They looked at just over 60 patients, and they broke them into 3 groups, and they actually measured how much lift the patients had. Group 1 had only thread lifting as a single procedure done just one time with barbed threads. Those are the threads that can lift. Group 2 had thread lifting and another rejuvenation procedure, either filler or Botox or PRP, which is platelet-rich plasma. That's another way to stimulate collagen. And Group 3 had what they call triple rejuvenation, which means they had fillers, they had Botox, they went on that PRP protocol, but they weren't allowed to have threads. So no threads for Group 3. And essentially in Group 1, which was thread lifting alone, as you see, even at 1 year, over 95% still showed pretty significant lifting. So at 2 years, 33.3% still showed some moderate skin lifting. In Group 3 without threads, whatever lifting they had achieved with the modalities they had used, it had declined to 0 at 6 months. There's literally been a little bit of a mini explosion in the past year, especially from Mint, one of the great PDO thread companies, in terms of thread design and getting us different options into our hands so that we can do a better job of repositioning tissue. So that's really been a game changer. And I do believe, and I've already seen, that we're going to see our results last longer and longer because our tools are getting better and better. The duration of your results is definitely going to be affected by how many threads are placed and that vector design. Most commonly, we see patients for threads aged 30s to 60s. Threads are also used by lots of people who want to either avoid surgery entirely or delay pulling the trigger on facelift surgery. And they're also used post facelift surgery. Thread lifting is just another tool in our anti-aging toolbox. If you've got a normal looking amount of volume and you're still doing this in the mirror, think about threads. Lifting threads, a great tool in the toolbox, collagen stimulation, lifting tissues that are sagging without volume. So I hope that this has been helpful. If you have any further questions, you can contact us at Renew Medispa. Please do go to our YouTube channel, like any videos that you find useful, and subscribe to the channel for more content. Thank you so much.